So electronic prescribing, what is it and what are the benefits? So this conversation, although aged care focused, is more directed to the community aged care side of it. So towards the end of the presentation, you will find more information and more relevant to residential though. So electronic prescriptions are the modern way and an alternative option for prescribers and their patients to use an electronic prescription as an alternative to the paper. So previously, a paper prescription was signed by the prescriber and it was considered to be the legal form by which the medicines were supplied. However, changes were then made to legislation in October 2019, recognising an electronic prescription as an alternative legal form by which medicines can be supplied under the PBS. So patients and prescribers were able to choose between either the paper version or electronic version, but not both at the same time. We're just going to play a short video now, just understanding electronic prescribing.
Electronic prescriptions are being used by people across Australia. A message is sent to your mobile phone or computer from your doctor instead of a paper prescription. And you can send it on or take it to a pharmacy of your choice. And if you take multiple medicines or have repeats, ask your pharmacist about an active script list to help manage your electronic prescriptions. Find out more at digitalhealth.gov.au.
Sorry, Jamie. Sorry about that. So the benefits of electronic prescriptions. So it provides an alternative choice, as mentioned, for patients. It can be a more convenient option. Supplements delivery of telehealth services to ensure continuity of patient care. It also provides an opportunity to protect community members and healthcare providers from exposure to infectious diseases. Maintains patient privacy and integrity of personal information through the token encryptions and the data protection measures. It reduces the risk of the loss of paper prescriptions and reduces admin burden for healthcare providers and organisations. So repeats on electronic prescriptions, how does that work? So pharmacies must provide the patient with a new repeat token. So this could be via SMS or email, or can be printed on paper. So this is in accordance with the National Health Pharmaceutical Benefits Regulations of 2017. If the prescription for the pharmaceutical benefit is an electronic prescription, meaning it is attached or linked by electronic means, the repeat authorization is given either as a printout of the repeat prescription or is able to be accessed digitally. And you can see there the QR codes that you might be familiar with. So if your token is expired or it's been dispensed or cancelled, it will actually show up on your app, and we're going to be talking about the application in a little bit. So when you have a script that has been cancelled by the prescriber, or it's expired or it's already been dispensed by the pharmacy, the token will no longer be available. There have previously been conversations about what somebody might be able to just grab my token and reuse it, but you can see here on the screen that there are some messaging. So when the link is accessed to view the token, the message will appear the prescription has already been expired, or it will say it's already been dispensed, or it will say it has been ceased by the GP. So as you can see in these examples, there is no QR code displayed as there was in the previous screen, and that's because a QR code won't appear as it's no longer valid, and it will just display whatever message is relevant to the scenario. So just a little bit of a recap. So electronic prescriptions. So your options are you can receive it via email, or an SMS, you can have a representative actually receive the token on your behalf. So this could be a caregiver, and you can use your mobile app to store those tokens. You can register for an ASL. ASL is the term that we use for active script list, and we will be talking about that in a bit more detail in just a moment. And you can view all your scripts via your relevant app. So just please stand by for a moment, because we will be talking more in detail on just that topic.